As you're logging into our Zoom webinar space today, if you want to use the chat to tell us where you're joining from, we love to see all the states and countries, various countries that participate on this webinar series. So feel free to let us know where you're coming from in the chat bar. You are attending today the Total Worker Health Approach to Recovery-Friendly Workplaces. We appreciate you being here. This is our 5th webinar in the HealthLinks webinar series of 2023. My name is David Shapiro. I am the Senior Manager for Programs and Partnerships for the Center for Health, Work, and Environment at the Colorado School of Public Health. I am a white male and I use he, him pronouns. Today, my hair is short and brown and curly. I'm wearing gray glasses. I'm in a light blue collared shirt. And my Zoom background is the HealthLinks logo in black and gray, sort of interchanging. And I'm joining you from our offices on the Anschutz, the University of Colorado Anschutz Medical Campus in Aurora, Colorado. Our center, the Center for Health, Work, and Environment, is one of 10 centers of excellence for total worker health funded by NIOSH, the National Institute of Occupational Safety and Health, at the Centers for Disease Control and Prevention. And today we're talking about recovery-friendly workplace policies and practices, really a key component to supporting the overall mental health and well-being of employees, and a critical element of the total worker health approach. A few housekeeping items before we get started. All of you as participants on this webinar are on mute throughout the duration of the presentation. We ask you to use the chat function, not only one to tell us where you're from, as so many of you are doing right now. It's so great to see all of these locations coming in, but also if you're having any technical issues, you can use the chat function for that. If you have a specific question for myself or the speakers today, we're going to ask you to move that into the Q&A box of your Zoom toolbar. That's because if someone may be having the same thoughts or question as you, and we can use the thumbs up feature to vote on those questions when we have the question and answer section. This webinar is being recorded, and we will be able to share a link to the recording with you as part of our follow-up. And a closed captioning is available for those of you that need it using the Zoom toolbar as well. And last but not least importantly, there is a survey at the end of this webinar for those of you claiming continuing education credits. We need you to fill out that survey. Not only do we appreciate the feedback on the topic and on the speakers, but also if you're looking to claim your CHES, SHRM, and other credits, then we'll need you to fill out the survey. It should automatically pop up at the end of the webinar, and if it doesn't, our technical support team will have that link available for you in chat as well. We always start with a land acknowledgement, and I will read that. As we gather in this virtual space, we honor and acknowledge that the University of Colorado's 4 campuses are on the traditional territories and ancestral homelands of the Cheyenne, Arapaho, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. Further, we acknowledge the 48 contemporary tribal nations historically tied to the lands that comprise what is now called Colorado. Acknowledging that we live in the homelands of Indigenous peoples recognizes the original stewards of these lands and their legacies. And with this land acknowledgement, we celebrate the many contributions of Native peoples to the fields of medicine, mathematics, government and military service, arts, literature, engineering, and more. We also recognize the sophisticated and intricate knowledge systems Indigenous peoples have developed in relationship to their lands. We recognize and affirm the ties these nations have to their traditional homelands and the many Indigenous people who thrive in this place alive and strong. We also acknowledge the painful history of ill treatment and forced removal that has had a profoundly negative impact on Native nations. We respect the many diverse Indigenous peoples still connected to this land. We honor them and thank the Indigenous ancestors of this place. The University of Colorado pledges to support and provide educational opportunities for Native students, faculty, and staff, and advance our mission to understand the history and contemporary lives of Native peoples. Our agenda for today is one, to start with a keynote presentation that helps us set the stage and foundation for where we are as a country related to recovery-friendly workplaces. And I should mention here, you're going to hear our presenters and speakers use a few different terms to describe recovery-friendly. You may hear recovery-ready workplaces or recovery-supportive workplaces. You may see those words on the slides. We are all talking about the same issue, which is supporting employees in their recovery journey through substance use disorder, mental health conditions in returning to work or in hiring individuals with those conditions as well. But recovery friendly is sometimes referred to as recovery ready or recovery supportive workplaces as well. We have a speaker discussion with a few panelists that will help provide context to our keynote presentation. And then we have time for question and answer with all of us at the back end of the hour. So that'll comprise our agenda. We're hoping that you can understand more of the characteristics of a recovery-friendly workplace and understand how problematic substance use impacts workers in the workplace, as well as identifying some key steps to becoming a recovery-friendly workplace. Today is International Overdose Awareness Day, August 31st each year, and this is our second year hosting a recovery-friendly workplace webinar on August 31st. The hashtag is End Overdose, or We See You, WESEEYOU. Overdose deaths are preventable. This is a public health mission and strategy, and recovery-friendly workplaces are part of the community to support individuals that are experiencing substance use disorder and part of the community to help, as a country, us end the epidemic of overdose. So I want to just acknowledge and affirm that today is Overdose Awareness Day, and there are some communication materials available to all of us to promote overdose awareness today and throughout the year. So with that, I'm going to introduce our keynote speaker, Jamie Osborne. Jamie is a public health analyst and certified health education specialist, currently on contract with the Office of the Director at the National Institute for Occupational Safety and Health, or NIOSH. As a leading member of the NIOSH Substance Use and Work Coordination Team, Jamie works to develop guidance, recommendations, publications, web material, and other communications products and resources related to the intersection of work and substance use prevention and recovery. She's provided guidance and leadership for the NIOSH effort to define and promote workplace-supported recovery, an initiative informed by total worker health principles and designed to prevent exposure to workplace factors that could cause or perpetuate a substance use disorder while lowering barriers to workers seeking care, receiving care, and maintaining recovery and employment. So thank you, Jamie, for joining us today. I'm going to stop sharing my screen and turn over the controls to you.
Great. Thank you, David. Let me work on getting my presentation loaded up here and make sure everyone can see it in the way that is intended to be shared. Just that. And all right, let me know if I'm in full presentation mode here for everyone.
You are in full presentation mode. We can also see, for a moment there, we saw the slides, the background, the next slide.
Okay. See here. I can fix that. That's so interesting. It says I'm in presentation mode. Let me try one more time. This is kind of what I was afraid of, David. Now it's not showing me that screen to share at all. So I may need you to share my slide for me.
Sure.
I believe I sent those this morning.
You did. Let me just pull that up real quick.
Thank you so much. Apologies for the technical difficulties here, folks. In the meantime, I will go ahead and get started. My name is Jamie Osborne. As David said, I am a contractor with NIOSH working on our substance use prevention and recovery portfolio. A big thank you to David and HealthLinks and the Center for Health, Work, and Environment for inviting me to speak with all of you. And today I'd really just like to use my time to talk a little bit about the connections between work and substance use and how workplaces and employers can play a role in preventing and addressing substance use among their workers and also supporting their recovery. I also want to build a little bit on what David was talking about with the language differences you might hear today. So NIOSH has developed an initiative called Workplace Supported Recovery. And more recently, there was a federal movement to establish recovery-ready workplaces that's really grown in support of the National Drug Control Strategy. And I'm going to talk a bit about these later. While workplace supported recovery and recovery-ready workplaces are not necessarily completely interchangeable with recovery-friendly workplaces, really the principles and the missions of each are largely the same. We're looking to support workers that are struggling with substance use to receive treatment, to achieve their recovery goals, and of course, to keep working and then keep all of that rooted in a focus on prevention and stigma reduction. I also want to note that my slides are very rich in links to resources and information. And since we have such a short time together today, I can make sure anyone who's interested in a copy of the slides can get that access. And I'll also have my contact information at the end of the presentation as well, so that we can touch base afterwards. If you can go ahead and advance the slide for me, David. Thank you. So on this first slide, we explore the many links between work and substance use. Lack of employment, insecure employment, and new employment arrangements all may increase the risk for substance use or misuse. Hazardous work, work-related injuries or illnesses, and difficult working conditions may increase the likelihood that a worker would be introduced to opioids through a pain medication prescription. And if a worker lacks certain benefits like paid sick leave, that worker may feel that they need to use an opioid medication just to push through their pain and make it to work rather than miss that day of pay. And of course, there are definite cultural, geographic, and occupational differences when observing substance use across the workforce. Next slide. Our nation's workers really have faced so many difficult challenges over the last few years, including the unrelenting rise in overdose deaths. During the pandemic, for the first time ever, more than 100,000 Americans died from drug overdose in a single 12-month period. And these increases were really primarily driven by synthetic opioids, which are extremely potent and commonly present in the illicit drug supply. In the 12-month period ending in January 2022, over 107,000 people in the United States died of drug overdoses and drug poisonings, and more than 2/3 of those deaths involved synthetic opioids. In fact, more than 150 people die every single day from overdoses related to synthetic opioids like fentanyl. There was an analysis from the University of Chicago and the National Safety Council that found that 1 in every 12 workers has an untreated substance use disorder. And unfortunately, we do see higher rates in industries with safety-sensitive positions, such as construction and mining. Next slide. And as I mentioned earlier, substance use challenges can arise from the use of prescription drugs as well. It's not just illicit drugs. The National Safety Council conducted interviews with over 500 human resources decision makers. This was a geographically representative sample of US employers with 50 or more employees. And more than 70% of those employers said that their workplace has been impacted by prescription drugs. But only 19% of employers felt extremely well prepared to deal with that. 71% said that prescription drug misuse is a disease that requires treatment, but nearly the same number felt that it was a reason to fire an employee, and only 4 in 10 employers would return an employee to work after they receive treatment. Now, one could assume that stigma may play a role in some of these attitudes. Next slide. And these stigmatizing attitudes, they really are pervasive. More than 3/4 of Americans surveyed believe that substance use disorder is not a chronic medical illness. And more than half said that they believe substance use disorder is just caused by bad character or lack of moral strength. And perhaps even more disturbing, about 45% of healthcare professionals, so almost half, expressed the belief that medications for opioid use disorder were simply substituting one drug addiction for another. And that was actually a higher rate than the general public. I do want to quote the researchers in this report. They said, "It's clear that negative perceptions of those with a substance use disorder are extensive and deep-rooted, not only among the public, but among employers, healthcare professionals, and even those with a substance use disorder themselves. These perceptions affect and often dictate how policies are created, how healthcare is provided, and how people perceive treatment. Most importantly, these beliefs entrench deep feelings of exclusion and shame for individuals with a substance use disorder throughout their lives, regardless of their recovery status, really powering a vicious cycle that makes substance use disorder much more difficult to address and fueling negative outcomes." Next slide for me. And in addition to the influence of stigma, employers and workplaces have to take into consideration the cost of workers with substance use disorders. Included in those costs are healthcare, absenteeism, turnover, replacement. The average employer pays around $2,900 in health insurance premiums or self-pay annually for workers without substance use disorders. But for those with substance use disorders, those costs are nearly $4,800 per worker. And additional annual average costs to an employer for each worker with an untreated SUD continue to rise. Next slide. But what workplaces may not realize is there really are considerable savings and gains involved in employing workers that are in treatment or in recovery. Each employee who recovers from a substance use disorder saves a company over $8,500 on average. Moreover, treatment that is prompted or mandated by an employer is often more successful than treatment that's initiated or encouraged by friends and family. Workers who are actively in recovery help employers avoid turnover, replacement, and healthcare costs. Additionally, workers in recovery tend to be strong employees. The analysis actually showed that workers in recovery miss fewer days each year than even the average employee without a substance use disorder. Those workers in recovery also tend to stay in those jobs longer, they're less likely to be hospitalized, and they have fewer primary care visits. Also of note, for those who are in stable recovery, the risk of a future recurrence of substance use disorder in any year drops below 15%, which is actually about the same annual risk for substance use disorder observed in the general population. Next slide. Now, for those of you who may be unfamiliar with total worker health, let me first define it for you as policies, programs, and practices that integrate protection from work-related safety and health hazards with the promotion of injury and illness prevention efforts, all to advance worker well-being. So we know that the workplace and work contribute to workforce safety, health, and well-being, and therefore work can be modified to improve those outcomes, right? We know that there are inextricable relationships that exist between many different safety, health, and well-being issues, not just on the job, but also off the job. Many safety and health issues clearly straddle both work and non-work spheres. And while we may only wear our worker hats during a portion of a 24-hour period, we can live with work-related health and safety issues 24 hours a day. Workers do not check their identities and personal lives at the door before entering their office or their work site, the same way that it's impossible to not sometimes bring home stress or health or safety issues that you experience at work. So the total worker health perspective really views the worker as a whole person and considers whole health impacts. And studies have shown that emphasizing that total worker health approach, and by that I mean a holistic, expanded, transdisciplinary strategy, really engenders more promising efforts and results. And the promise of total worker health is vast. It can extend not only to the worker and the employer, but also beyond to family, community, and society. And substance use disorders, and overdose are issues that broadly impact workplaces. So it really is more important than ever to use a coordinated systems approach to meet the needs of employers and workers. NIOSH applies total worker health principles and strategies to prevent and address worker substance use and support workplace recovery efforts. Next slide. So similar to state and local recovery-friendly workplace programs, NIOSH has developed guidance for establishing a workplace-supported recovery program in which employers use evidence-based policies, programs, and practices to reduce multiple risk factors, to help workers seek the care that they need, and to provide assistance in recovery. And ideally, workplaces will provide individual, family, and community support and improve the overall well-being of their workforce. And really, work environments should proactively prevent substance misuse. So prevention is a really key aspect here. We also want to focus on reducing stigma and that encouragement of treatment and sustained recovery. So a recovery supportive workplace really understands the true nature of substance use disorders and recovery, as well as the factors that support the initiation of treatment and the maintenance of recovery. It understands the importance of employment. Employment provides economic stability, a meaningful social role, and often direct access to treatment and recovery services. Employment also provides relevant sources of recovery capital that can motivate and maintain a desire for treatment and recovery. So a recovery supportive employer really encourages workers to seek treatment and initiate recovery early in their disorder, provides access to those evidence-based resources. And that might look like return to work plans, second chance employment, workplace accommodations, other return to work assistance, and providing peer support and peer coaching to bolster the social supports that are available to workers that are in recovery. And again, I really just want to emphasize that prevention piece of the total worker health approach. What are those upstream factors that workplaces can address to prevent substance use challenges? And this might look like identifying occupational injury and illness risk factors and taking corrective actions. That might look like addressing ergonomic hazards that could lead to musculoskeletal injuries. Those injuries could be treated with opioids and put workers at risk for opioid misuse and opioid use disorder. So kind of examining your work environment for those hazards to prevent them. Providing training and information on opioids and opioid misuse, and especially timely targeted information for injured employees. Offering, again, and facilitating access to peer support in the workplace to help workers sustain their recovery efforts and reduce the risk of a return to substance use disorder. And then, of course, reducing opioid and other controlled substance prescribing through workers' comp prescribing guidelines. So these are all strategies for preventing substance use in workers, but work-related factors can also impact recovery. Aspects of the work environment may decrease or increase the likelihood of initiating and completing treatment, achieving and sustaining abstinence, maintaining involvement in long-term care if that's required, and developing and sustaining the improvements in physical, mental, and social well-being that really are the essence of recovery. And there's really a lack of systematic research on the association between the workplace and recovery. So we don't really know exactly which workplace hazards and supports will have the greatest impact on the recovery process. But in our research, we have identified potential workplace recovery hazards and potential workplace recovery supports for employers to consider. So recovery hazards might include negative working conditions. And by that, we mean excessive demands, workplace bullying, job insecurity, a hazardous physical work environment, and work-related injuries and illnesses. Obviously, the physical availability of substances at work, kind of a no-brainer, but something that really needs to be examined, along with workplace social norms and work-related rituals that support substance use. And of course, an exposure to stigma at work. All of these can be potential recovery hazards in the workplace. But there have also been identified recovery supports that have been examined, and we're hoping to dive a little bit deeper into in our research. But what we've been looking at are those positive working conditions. So fair treatment, recognition and meaningful work, skill variety and the acquisition and use of those skills, autonomy, fair rewards and promotion opportunities, and friendship formation and social support from coworkers and supervisors. So that, along with organizational support, we really believe could be potential recovery supports in the workplace. And I do have some links here for our workplace supported recovery program, some of our research, some of our work in the recovery-friendly workplace space that we've partnered with NIEHS on. So again, I really encourage you to check out all of the links that are in this deck. But we can move to the next slide, David. NIOSH has also developed a portfolio of information and resources for employers, workers, and workplaces, all of which can play a role in a comprehensive workplace-supported recovery or recovery-friendly workplace program. All of these can be found through our Opioids in the Workplace webpage, which I have linked here, but I want to highlight just a few in the interest of time. So for workers that are struggling with opioid misuse or opioid use disorder, medication-assisted treatment, or MAT, which is also known as medication-based treatment or medications for opioid use disorder, can really be an integral part of treatment and recovery. Definitive treatment is an essential part of the long-term solution to substance use disorder, and MAT is really the gold standard. So NIOSH has developed a workplace solutions document, which provides information for employers who are wishing to assist or support workers with opioid use disorder. It describes current treatments, and it also provides a multi-step set of information on creating a workplace atmosphere that really focuses on prevention, opioid misuse minimization, decreasing stigma, and then supporting folks with opioid use disorder through treatment and back to work. Next slide. NIOSH has also developed a fact sheet titled Using Naloxone to Reverse Opioid Overdose in the Workplace. And that can help employers and workers really understand the risk of opioid overdose. And it provides guidance to help them decide if they should establish a workplace naloxone availability and use program. Again, that's another vital component to any comprehensive workplace supported recovery program or a recovery ready or recovery friendly workplace. So naloxone hydrochloride, which is also just known as naloxone or by its brand name Narcan, is a drug that can temporarily stop many of the life-threatening effects of overdoses from opioids. It can be given nasally and help restore breathing and reverse sedation and unconsciousness. So timely administration of naloxone can actually save the life of a worker or a member of the public who has overdosed on opioids at the workplace. Naloxone is easy to use, it is small to carry, it is safe, it is effective. Naloxone works if a person has opioids in their system, and it has no harmful effect if opioids are absent. There's no evidence of significant adverse reactions to naloxone. So anyone can carry it, can give it to someone experiencing an overdose, and potentially save a life. There was actually a recent study that found that bystanders were present in more than 1 in 3 overdoses involving opioids. So really, with the right tools, bystanders can act and prevent these opioid overdose deaths. Next slide. So the fact sheet really provides practical, applicable guidance to workplaces that are considering a workplace availability and use program. It includes information and considerations related to liability, training, maintenance, as well as just information about purchasing and storing naloxone. I also want to note that earlier this year, the U.S. Food and Drug Administration actually approved Narcan for over-the-counter use. So it is the first naloxone product that has been approved for use without a prescription. And this really paves the way for naloxone to be sold directly to consumers in places like drugstores, grocery stores, gas stations, as well as online. And I have the links here to our fact sheet, as well as the CDC's page on naloxone and the National Safety Council's Naloxone in the Workplace Toolkit. Next slide. I also want to quickly highlight the Recovery Ready Workplace Resource Hub that's hosted by the DOL. I see that I'm running out of time here, but I do just want to highlight this. It's a really, really rich hub full of information, guidance, tools, best practices, and a range of other resources to really help workplaces effectively address substance use disorder in the workforce, to hire people who are in or seeking recovery, and then support ongoing recovery within the workplace. There's also a really great section on stigma reduction. And we also have a toolkit that will be launching next month, and that will be hosted on the hub. So I encourage you to check that out and to keep checking back, because we're always expanding and updating the hub. And I will pause here because I believe that I have definitely hit my time, but I look forward to joining you all for the discussion later. Thanks, David.
Thank you, Jamie. As we switch presentations here, the takeaway for me is always the same on some of these conversations, which is that the workplace is a really important element of the recovery community. That has not always been the case. And so that's the first thing I want all of us on the webinar today to understand, is that through work and through employment and through employers, you're part of the community that can help tackle the issue of recovery and recovery supported workplaces. So with that, we're going to switch over to provide a little bit more context to Jamie's comments. And just to mention as well, again, if you have questions for Jamie and our other panelists, please put them in the Q&A section. Some of your fellow participants may be having the same question, and we can use the thumbs up feature on Q&A to move those up. We're hoping that we can get to questions questions, around 11:45 Mountain Time in the next 15 minutes or so. With that, I'm going to introduce Cal Beyer. Cal is the Vice President for Workforce Risk and Worker Wellbeing at Holmes Murphy and Associates. He has 30 years as a safety, health risk management professional, and he's dedicated to the construction and manufacturing industry since 1996. Cal launched a mental health and suicide prevention initiative in the construction industry in 2014 while working for a contractor in the Pacific Northwest. He serves with the National Action Alliance for Suicide Prevention since its formation in 2010 and was appointed to the executive committee in 2016. He also serves on the Lived Experience Advisory Committee of the Suicide Prevention Resource Center and advisory groups for Goldfinch Health, MindWise Innovations, U-Turn Health, Construction Business Owner Magazine, and the AGC of America Mental Health and Suicide Prevention Task Force. He's a former member of Expert Advisory Group for Center for Workplace Mental Health. He's been recognized by Engineering News Record as a top 25 newsmaker, and he's also the recipient of the Mental Health Advocacy for Industry by National Association of Home Builders in 2022. So thanks, Cal, for joining us today. Really appreciate you being here.
David, thank you very much. My camera is not going on, so it's okay. I'll just continue this conversation. What you said about the workplace is critical. Jamie's presentation provided so many great links, so many great connection points, launching points, opportunities for employers to embrace this idea of recovery-ready or recovery-friendly workplaces. That work with the National Action Alliance grew out of my long-standing work in human capital risk management. And what I've learned is substance misuse and substance use disorder are very important issues. They became major workplace and workforce stressors. There was more stigma associated with substance misuse, where we didn't even really talk about substance use disorder until a few years ago. What I wanted people to know, this is such a critical issue. This can be life-saving work. I've experienced peer-based recovery programs in multiple industries, including public safety, various professions, healthcare, construction, manufacturing. I became an ally without knowing that term, ally. And being an ally for recovery-friendly workplaces has 5 common hallmarks, David. If you would shift to that next slide. We wanted to just highlight a few of these elements. I did see some of those questions. First and foremost is stigma reduction, being very intentional to build an inclusive and caring culture. It focuses around this idea of acceptance and affirmation. So that is supportive for persons in long-term recovery, where they feel welcomed, they feel valued, appreciated, and mostly affirmed. If we can build a sense of belonging, that community ties to life-saving connections. That's the most important of those hallmarks. The second is flexible policies. Jamie identified a few of those, but the ones that I've seen that can be very flexible will be those around leave and return to work. So people in long-term recovery can address their physical health, their mental health, and aftercare for substance use disorder. Those are elements that become very important, and having flexibility around that paid time off and having flexibility around work schedules and availability allows people to fit life into their work and to establish proper work-life balance. The third of these hallmarks that are so important is peer-to-peer mentoring and support. I saw some great comments. Someone even said, yay, peer-to-peer support. To me, that's the secret sauce. When coworkers become allies in recovery for others, it reinforces that we're in this together. It reinforces that belonging and caring, inclusive culture. And that's promoted through on-site recovery meetings. That's a bold step. Many employers have been afraid to take that bold step of having it be on-site. Many labor unions have been embracing this idea of member assistance programs, and within member assistance programs, bringing recovery meetings to the union hall and to the job site. And it's been a very powerful transformation. It's really opened the pathway to more people being in active recovery pursuit. And the last of those hallmarks would be ongoing training, resources, and support. The goal here is to promote that active recovery, not just for the workers themselves, but for those in their spheres of influence. So this can be a source of future recruiting for other workers, but it can also be for dependents on those employee benefit plans, the family members and dependents who are impacted also by substance use disorder and the recovery process. We have to realize that jobs are a major source of recovery capital, and I think this is really an important consideration. So David, if you move to the slide that we identified, what can employers do? Action steps. First and foremost, we need a reality check. We need to accept that substance use disorder and substance misuse are significantly impacting your business and affecting your workforce. The National Safety Council Cost Calculator can help you identify both the prevalence and the financial and human impacts of substance use disorder. I'd like to give a shout out to Carolyn Delaney. She's a person in long-term recovery who is the founder and publisher of Journey Magazine, a magazine that is dedicated to making recovery visible. She uses that National Safety Council cost calculator frequently in her work, and I've seen the way it's transforming the way businesses are approaching this reality check. And secondly, once you recognize the human and financial costs, this human capital risk management, leaders will commit to taking action. And some of the earliest adopters of recovery-friendly workplaces have been those leaders with personal or family lived experience. They share their vulnerability to why this matters to them, and that they want others to have the benefit of hope, help, and recovery. Those leaders who make themselves vulnerable break down barriers, they reduce stigma, they promote active care, and they put the cultural framework in place to make this happen. The third thing that employers can do immediately, and that's evaluate and share resources. You want to develop a very robust list of internal and external resources. The Employee Assistance Program or employer and union-sponsored health plans can be very important resources to share with employees, but also many community-based resources, groups like AA, NA, recovery-friendly community organizations that comprise governmental, nonprofit, faith-based organizations. There are more resources available than we're aware of when we start this journey toward recovery-friendly workplace. And tap into organizations that can help you. The fourth hallmark in terms of an action step would be manager and supervisory training. This becomes very important. We want to teach them the why, how, and what of recovery-friendly workplaces. We need to drive that cultural alignment with business strategy and be clear on expectations, why we're doing this, and provide pathways for allyship. If we can get support from managers and supervisors, you're going to have a much more likely successful adoption and implementation of a high-impact recovery-friendly workplace. And then education for all employees is very important. Very few people seek access or help with substance use disorder. The data shows well less than 10%. We can become a safety net with a recovery-friendly workplace. We wouldn't have to do this in the workplace if traditional methods worked, but they can work well in a workplace because of those benefits, the employee assistance program, and the peer-to-peer support that we can provide. So that leads then to this idea around partnership. What HealthLinks has done is similar to what's been done in Connecticut, New Hampshire, and now over 20 other states. These state and local initiatives can be a positive role model in recovery-friendly workplace. So I want to be able to pass this back to David so we have time for another workplace advocate for recovery-friendly workplaces. A friend of mine, Christina Ewing.
Thanks so much, Cal. You know, a number of you are having a terrific dialogue in the question and answer section, and a lot of comments have come up about stigma and how to reduce stigma. A lot of Cal's talking points: leadership commitment, buy-in, support, education and training, help normalize the conversation. So raising awareness is really the first step to reducing stigma, getting individuals educated and learning more about substance use disorder and problematic substance use. I want to introduce Christina Ewing. Christina brings a unique approach to the well-being space with background experience in retail management and the construction industry. And after 12 years leading the finance department for Anderson Construction, Christina proposed and led the development of a new holistic design of what is now a robust health and well-being department. At the forefront of everything Anderson does is their vision statement to be the, quote, builder of choice, which extends beyond clients to the families they employ. With that guiding each decision, Christina continues to implement comprehensive, award-winning programs that are health-focused, service-oriented, as well as fiscally responsible. Christina currently serves on several industry-wide committees dedicated to prioritizing physical and mental well-being and breaking down the stigma around mental health. In her personal time, you're likely to find her working hard to maintain status as the favorite aunt, cheering on a Portland Timbers match, or taking in all the snuggles that her Irish wolfhound Rooney is in the mood to offer. Thank you, Christina, for joining us today and telling us a little bit more about how Anderson Construction is approaching the recovery-friendly workplace conversation.
Thanks, David, and thanks, Cal, for the introduction. You can go ahead and move to the next slide. And so Cal did mention a lot of the things that I'll go over. And so this is just a little bit more of kind of how we implemented those things in practice. So some of the things that we started with, and I think it's really important to really understand what your industry is dealing with in terms of the unique aspects of it. And certainly construction, we've heard about, is one of the leading industries, unfortunately not one that we're proud of, in terms of substance abuse and misuse. And so being able to make sure that our leadership really understands that, the facts associated with that and the numbers that our people are affected by this, that was kind of step one. So really buy-in that is issue, buy-in around the things that you're going to be implementing certainly is important. Otherwise, with most things, there isn't traction beyond that. I think it's also important next step to really know your resources. There's plenty of state and federal and local resources. If your company isn't in a position to be able to fund them themselves, don't let that stop you. There's a lot of things available in the marketplace that don't have a cost associated with them. And being able to have those at the ready is going to be very important, because the more you talk about these things, the more people start talking about them with you and asking questions. So you'll start to be surprised about some of the conversations that people have and how open they can be around their struggles and things that they're dealing with once you kind of open the floodgates, so to speak. So having those resources handy and knowing what they are is going to be primary important before you start any of these things. And then I like to say beef up the benefits, because that's my bread and butter. And so some of the things that we did, for example, you've heard about the EAPs, and most of you probably have those. Where construction is unique is we have a heavily union workforce, and union has their own set of benefits outside of what we offer to our non-union employees, which can cause a bit of a disconnect. And so what we were able to do was offer the EAP to all of our workforce, which includes the union staff. So that was really easy for us to then be able to message one number, one workforce, one group. And we extended those benefits, or increased them rather, to the maximum that we could offer under IRS guidelines. So the maximum amount of visits that people can get with the EAP for free under that program. And then on the health plan side, for those who are under the non-union health plan, we made mental health benefits in and out of network the same price. So many of you probably have heard or seen or dealt with through the pandemic people needing care and the lack of availability of providers. And so for us to be able to flip that switch and make what's a small financial investment in terms of covering out of network pricing, which relates to a huge a level of access for our members. And certainly if someone is familiar or comfortable with a therapist or a counselor, it's really hard to make that transition and essentially start from scratch with someone and find and build a new rapport. So, and then lastly, in this way, is identifying your allies. So there's always going to be people in the organization who are big proponents of whatever program you're rolling out. And so being able to identify the people who not only feel the way that you hope they feel about programs like this, but also can speak to it in an intelligent way and in a caring and thoughtful way, because again, these are very personal and difficult conversations when they do come up. Next slide, please. And then how we kind of got started. So I like to call it mental health light. Anytime you are taking on something like this that's new for your organization, it's hard to go into things that are really, really big. So Cal had mentioned the Suicide Prevention Partnership that he helped found, which we're a member of. And it's hard to go in and talk about things directly like suicide, for example, or Narcan or addiction, right? Those are really heavy topics and sometimes very off-putting if you don't kind of lay the foundation. And so we started with things that are mental health light or mental health adjacent. So talking about some physical health things, sleep, and things that we all know affect mental health, and kind of laying that groundwork of, we're here for you as an individual, making sure that they know that they have the resources to back up the things that we're supporting, and then gradually building that foundation for when we did move on to those heavier topics. And breaking down the stigma. I know Cal mentioned that being super important, and there's a lot of ways, and one of the most effective is just continuing to repeat it and talk about it over and over again. I myself take the stance of a little bit of self-disclosure, which I think goes a long way. And so I talk about my own history of anxiety and depression, and we have a huge family history of substance abuse, and that is really difficult. But when you talk about those things, one, it gets easier the more you talk about it, but two, you will be so surprised about how many people connect with the things that you say and the stories that you share. And again, talk about opening the floodgates. You will be surprised about the amount of people that come up and just genuinely feel that you're a safe space and someone that it can talk to and know that you're a resource. And so then furthering on to educating, discuss, sharing. So we do that in construction through toolbox talks, which in construction, there's morning huddles. We do stretch and flex for injury prevention. There's talks about the construction project, and then we will add in topics that we think are going to be useful or things that we want to kind of target or hone in on. And so certainly things around mental health and substance abuse have been part of those conversations regularly. And then lastly, we've heard about Narcan or naloxone quite a bit today, but super important to be able to have that available. And we made the investment to have those on every single job site and office that we have. 2 doses each, because if you've done the training, you know that you should always have 2 on hand at all times. It's not under lock and key, so if someone needs it and it goes missing, great. They needed it and they took it, and it's going to go to use. The other thing that we were able to do is find community programs that we can donate them to shortly before they expire. So the community programs actually can use them. I think they said up to 6 months after the expiration date, but they don't technically last, or I should say not technically, but they don't typically last that long. They use them, unfortunately, very quickly. So being able to really show the commitment, not just to our employees, but to the community around us was really important as we implemented that. And, like similarly with things like CPR around our job sites, we're in Portland, Oregon as one of our primary spots, Seattle, Washington, another. There's a lot of people that, live around our job sites. And CPR has been used on people that are not part of our job sites, but, pedestrians or people living nearby. So educating around that not just affects the people that are on our job sites, but the people that are near our job sites. And then those people take that information home with them as well. So you're really affecting a lot of different people and a lot of different areas with just these few conversations that you have.
Great. Thank you so much, Christina, for that. Thank you for the terrific dialogue, all of you, that's going on in the Q&A section. We have time to address a few of the questions that are still there. If the panelists want to and speakers want to rejoin me here for the Q&A section, would appreciate that. I think I'll start, Christina, with a question maybe for you, and we'll open it up to Cal and Jamie as well, which is around personal health information, anonymity, and HIPAA. This is a pretty sensitive conversation for a lot of individuals. We know that we don't have any lawyers, and so nothing we're saying here is legal advice. But how do you sort of encourage people? I know you talked about your own self-disclosure and speaking up, but how do you hold some of this information about individuals, with fidelity and integrity if they're talking about these conditions? Do you have any suggestions around HIPAA compliance and anonymity and sort of some of those potential barriers to organizations talking about substance use disorder treatment? What has Anderson done?
Yeah, I think that's a really valid concern because people do tend to be fearful about speaking up for just that reason: fear of retaliation, fear of shaming, guilt, all those things. And so in my organization, I also administer FMLA and leaves and stuff like that. So the two kind of go hand in hand. And when I do have those conversations, there obviously are people that I need to loop into someone's going on leave and the high level of why. But what I tell the individual up front are like, these are the things that I have to disclose, and these are the people that I have to tell them to. Outside of that, it's your news to share. And I don't share their business with other people. And so as you kind of build that reputation of a safe space, then people feel more and more comfortable. But when you do, because we all have those situations where we have to escalate something or let managers know that people are going to be gone, right? And so telling the individual so that it doesn't seem like a breach, and then also defining what exactly you're going to be telling our manager so that they also know what you did have to share.
Got it. Cal, did you have anything you want to add around anonymity and compliance and how difficult it can be to share?
Thank you, David. I think Christina nailed that really well. I think that idea of need to know is really an important consideration. And I think what she described there is partner with that employee so there's no blind side, so there's clear expectations, and get that employee to kind of help you with the crafting of that message. So again, there is that opportunity. I've seen organizations build a bridge, not have the third party in HR or benefits be the only person having that conversation, but kind of pre-negotiate with the manager. So it does show organizational support. It doesn't feel like an intermediary. That's one strategy that I've seen work. And I think that's part of this process.
Got it. Jamie, I'm going to switch over to you for a separate question, which is really relevant to the work that we do at HealthLinks, which is, the recommendations we gave may be applicable to mid and even large size organizations, but what about the small workplace? We're talking about less than 50 employees, maybe even less than 10 employees. I feel like a lot of the strategies that Cal discussed and Christina shared with us as well are applicable to all workplaces, regardless of size. But, knowing that so many of our representatives on today's webinar are representing small and mid-sized businesses, I'm curious if NIOSH and you have done any specific research on this, type of workplace, and if there's other factors to consider in the small or mid-sized workplace.
Right. Thank you, David. I did see that question in the chat. And I think this really brings us back to really trying to create that culture of support and that workplace atmosphere where we can bring folks along. If you can have everyone on the same page, you can really create, I think Christina used the phrase safe space for folks to seek out that help that they need and assistance in recovery. And if they need certain workplace supports or accommodations, they can feel a little bit more comfortable doing that, knowing that everyone is really rooting for them right at the workplace. So I would say really focusing your stigma education broadly, making sure that you're having those consistent conversations about substance use, about treatment, about recovery, so that it's not a scary topic for folks to approach. That would be my kind of high level optimistic approach, but I'd love to hear what Cal and Christina have to say about their experiences with that.
Well, Christina, I was going to go to you next. One, to ask just a little bit about, how many employees are at Anderson. If you all are a mid or small business, I'm not sure about that. But what I did really appreciate before I turn that over to you about you talking about is how to approach mental health light, or some of the conversations around general mental health and healthy sleep and fatigue management before perhaps diving into substance use disorders and some of the more difficult conversations. So if we think there's stigma around talking about substance use disorder and disclosure, it starts with talking about mental health in general. And the more we get comfortable about talking about mental health, I think that bridges into us feeling more comfortable talking about substance use disorder. So I really love the mental health light approach, but I'm curious if you have any other suggestions based on, Anderson's positioning.
Yeah, and to answer the other question, we have about 1,000 employees, just under 1,000. So
Okay.
medium-sized business, I would say.
Mhm.
And in terms of mental health light, some of the things that we did was we introduced some different techniques. So things like tapping, which isn't as commonly known. And it was really cool for us to have a practitioner come on site and have a whole construction site full of workers take off their hard hats and do tap. Familiar with that? It's where you literally tap on various points of your body, and it interrupts kind of the circuitry, similar to how acupuncture would. So it's a really kind of unique, in the moment, kind of therapeutic thing that you can do to interrupt a stress cycle, and even have some pain management components to it too. So introducing things like that that allow people to have an actual technique that they can literally take with them anywhere was something that we found to be impactful.
Yeah. Appreciate that. We've worked out with a lot of small entities on mindfulness and meditation training, which some of those principles, can be shared broadly as well. Cal, did you have anything else you wanted to add around the small business experience? Anderson, with 1,000 employees, we'd probably consider you, to be a large employer, anything over 500. But from your work in the field, Cal, anything specific that small and mid-sized businesses should think about?
Yeah, I think, again, that's the opportunity to partner with organizations like yours, HealthLinks. You get the opportunity to build a peer network of fellow allies. And I wanted to let people know I was gifted a book a year ago by Carolyn Delaney called Recovery Allies by Allison Webb Jones. It is an incredible book with practical information. She built it around 8 pillars for recovery allies and many practical tips for small and medium-sized businesses, many specific little small case studies that would be helpful, I think, for your readers. It's got a cool purple cover, and it's a very, very readable, useful book, and so many great living examples that it would be helpful, I think, for small and medium-sized businesses.
Thanks again, Cal. And thanks again to our speakers and presenters, Jamie, Christina, and Cal, for your perspectives today. Remember that today is Overdose Awareness Day. We can all work together to #end overdose. This is a preventable public health condition, or public health battle, one that, it takes workplaces, it takes individuals, family, and friends to combat. I want to mention that we have another webinar coming up in October on women's health and well-being. Many of you already signed up for that. I did want to make one comment, which is I saw a question about defining the term long-term recovery. I'm going to shift from that question to think a little bit more about substance use disorder as a medical condition. Language is really important. And, there's work going on in terms of shifting language in the field, of saying things like individuals have returned to use rather than they've relapsed. If we think about a medical condition like diabetes, you don't return to diabetes. You don't relapse with diabetes. You have flare-ups and exacerbations of the medical condition. And so the more we think about substance use disorders as a treated medical condition or a treatable medical condition, the more we can say this is something that someone experiences over a lifetime. And therefore, long-term recovery, when you're in recovery, might be over a lifetime as well. So I want us all to get in the frame of thinking about substance use disorder as a medical condition. And therefore, if someone returns to use, they haven't necessarily relapsed. They are experiencing that medical condition in a different way later on down the road. And so the more we can think about it that way, I think the more we can also educate, inform others, and reduce stigma. So with that being said, our next webinar is in October on the 18th about women's health and well-being. We know that women have been really stretched thin since the pandemic started, and even before that, in terms of managing the mental load on so many arenas, including work. And we're going to have a really robust discussion with a number of experts in the women's health and well-being field. For those of you claiming credits, as you log off today, hopefully the link to the survey will automatically generate in your web browser. We are also going to put a link to the survey in the chat, and we will keep this room open for a little while to make sure you access that. Just know that as an attendee today, you will also get a link to the survey in the follow-up email, which will be coming to you. Our goal is tomorrow. And so please fill out the survey, not only to give us feedback for the event, but also for claiming your continuing education credits. Such an important discussion today on World Overdose Awareness Day, but really at any day and at any time of the year. We want to thank all of our participants for joining us again today. And again, a big thank you to Jamie, to Cal, and Christina for your comments. So thanks, everyone. Have a great afternoon.